This is Rick Fines, and I, along with Nahush Mokadam, are very pleased to be the course directors for an STS University course directed towards academic cardiothoracic surgeons who wish to learn how to teach using the TSDA cardiac surgery simulation curriculum. This curriculum is the product of a 3-year grant funded by the Agency for Healthcare Research and Quality, and it was done in 8 institutions across the country. These are the Massachusetts General Hospital, Johns Hopkins University, the University of Rochester, the University of Washington, Stanford University, Mayo Clinic, Vanderbilt University, and the University of North Carolina at Chapel Hill. During the course of this 3-year trial, over 30,000 data points and 3,000 hours of simulation-based training led to the development of a comprehensive 29-session curriculum. And it is this curriculum that will be imparted to the participants at the STS University course. The full 160-page syllabus that clearly outlines this curriculum will be presented to each of the participants. This is the title page for that syllabus. It is based upon these principles that we identified important cardiac surgery procedures, 3 important cardiac surgery procedures, and 3 adverse events. Each of these were broken down into its critical component tasks. Sessions were developed and component task simulators were created to teach these tasks using deliberate practice and multiple repetitions. Finally, at the end of each of these modules, these component tasks are combined to produce full procedures. These are the primary cardiac surgery procedures which you will be learning about today: the cardiopulmonary bypass, coronary artery bypass, and aortic valve replacement. The adverse events are massive air embolism, acute intraoperative aortic dissection, and sudden deterioration of cardiac function. The syllabus for each one of the sessions includes an overview for that session, the prerequisites, the objectives of the session, the equipment required, how to set up and use the simulator, how to conduct the simulation with a step-by-step approach, and also the assessment tools that are particular to that particular session. Just quickly, these are the breakdown for each of the 6 modules: a 4-week session for cardiopulmonary bypass with venous cannulation, aortic cannulation broken down; a 5-week session for coronary artery bypass grafting with both proximal and distal; a 5-week session for aortic valve replacement, including a full session on de-airing the heart; sudden deterioration of cardiac function, which is again a 6-week session that ends up with full, almost a final exam where the resident can be experienced to any one of the variety of adverse events that he or she has been taught during the preceding weeks. So we're very excited to be able to present this to you, and thank the STS for allowing us to be part of this course. We think you'll enjoy it. Again, this is aimed primarily at faculty who are teaching our residents and others that are interested in simulation-based training. It is not the intent of this course to teach these skills to the participants, but rather to teach the participants how to teach the skills using the syllabus, the component task simulators, and the principles of deliberate practice.